You are joining us today for our session on nutrition during and beyond pediatric cancer treatment, subtitled Diet and Cancer, More Than Just Slushies. I bet that was that one of you?
No, that was the old title. No, yeah, a previous title, yeah.
Yeah, I saw that somewhere hidden in the notes, and I love that. More than just slushies. Everyone, just so you know, today's session is going to be recorded so that it can live on our Kids Cancer Care website for further viewing as we go. My name is Karen Schlegel. I'm on the education support team at Kids Cancer Care, and I welcome all of you. We have a couple of staff members on board, hidden and not hidden. We have Stephanie, our food services manager at Camp Kindle. Thanks for coming today, Stephanie. And Pam, I know she's listening. Pam is our new family engagement coordinator that brings a wealth of experience to that role, newly at Kids Cancer Care. I will introduce our guest speakers, Brittany Campbell and Susanna Law, shortly, more formally. But first, I just want to give you a few bits about our education support program, of which this webinar is a part of. So we have that main mission at Kids Cancer Care to provide families affected by childhood cancer with support to help them survive, to help them thrive. And along with many numerous programs, we have an entire education support stream that's available through 4 main programs. We have our Cancer in the Classroom program that is led by our child life specialist on staff, Kim Clark. Kim helps kids transition back into school safely. She goes into the classroom to build awareness with a child's classmates and the school community about childhood cancer. We have our tutoring program, which offers up to a year, sometimes even more if volunteer tutors can commit, a year of one-to-one learning support to cancer patients and their siblings, and of course our cancer survivors. We have our Derek Wansura Memorial Scholarship Program. Each year we offer scholarships to patients and survivors of childhood cancer, help them alleviate some of the financial stress that's involved in pursuing post-secondary education. And finally, we have our family education support program, including our webinar series, of which this is one. We have the last couple of years, moving into the pandemic, held spring and fall webinars, bringing in lots of speakers with expertise in very specific areas, sharing their current research, offering some new knowledge and some practical ideas. And one day, post-pandemic, we hope to go back to our family conference again. So all of these programs, all of these education support programs specifically, all are free. And they are a result of a recent generous grant from the Fowler family in memory of Stephen Fowler. The Fowler family grant is enabling us to expand our education support staff, moving from a part-time staff to 2 full-time positions, and you will see us beginning to expand our programs as we go along. So for today's session, our speakers are going to address questions at the end because we know you will have some questions. If you have questions that pop up along the way, just park them in the chat box. And then at the end of the 2 speaker sessions, we'll address those and any other questions that people may have. Just a quick Zoom overview. Kindly keep yourself muted during the talks, except for our speakers, of course. And feel free to keep your video on so we know that you're there, but we understand it's more comfortable for you. If you didn't get a chance to comb through that hair today, or if you're still eating your lunch, feel free to do what you need to do there. So now I'd like to introduce our guest speakers. We are very privileged to have Brittany Campbell and Susanna Law with us today. First, Brittany will speak. Brittany is a registered dietitian. She's been working at the Alberta Children's Hospital for 11 years including 8 of those in oncology and the bone marrow transplant program. Brittany completed her Brittany, dietetic?
Yep, you got it.
I don't use that word very often.
No, it doesn't come up often.
She completed that internship at the Calgary General Hospital. Susanna.
No, Susanna, actually.
I went down to Susanna. Popping up back to Brittany. Sorry.
Yeah, the hospital no longer existed when Brittany was around. Yeah.
Yeah, I thought Brittany doesn't look that old. But she was at the Children's Hospital. Like me, I was born there. Okay, back up to Brittany. My apologies. Brittany's been at the Alberta Children's for 11 years, 8 years with oncology and bone marrow. She completed her internship at the University of Alberta. Brittany believes food is important for nourishing the body while also bringing a sense of joy and community and bringing family and friends together. Very timely for Christmas, Brittany. Yeah. So Brittany's going to begin first with nutrition during pediatric cancer treatment.
Okay, awesome. Thanks for the introduction. It's great to hear all the things that the KCC is doing as well. I didn't know all of that. Okay, so I'm going to share my screen. All right, can everyone see that?
Got it.
Got it, it's good. Okay, perfect. Well, thanks everyone for coming and welcome. So I'm going to talk a little bit, mostly around nutrition during pediatric cancer treatment. All right, so I just have to move my camera a little bit. Okay, so kind of the outline of the things I'm going to talk about today is nutrition to fuel the body during treatment. I'm going to go into a little bit about healthy bones because treatment can play a role in that. I'm going to talk about some nutrition misconceptions, myths, whatever you want to call them, that exist out there, because there are lots of them. And a little bit I will talk about just creating positive mealtime experiences. So during cancer treatment, body requires fuel, and we get fuel from food. And during cancer treatment, we see many kids and adults have increased energy requirements. So we get energy in our diet from carbohydrates, fat, and protein. And now children need all three for growth and development. Infants and younger children's diets in general have a higher percentage of energy from fat. So when I talk about the increased energy requirements, so we can see kind of up to usually 20% of energy requirements above kind of what a kid without cancer would see, but it can be a range. They don't always have increased requirements. Things that play a role into that is like the presence of a tumor, if they have a fever, if they're recovering from surgery, those can all increase energy requirements. So the first thing I'm going to talk about is protein. Everyone needs protein. Children need protein to grow. Protein is essential for building muscle and preventing muscle breakdown. Protein is also essential in building the immune system. So I actually often hear a lot about, people wondering what foods they can eat to build up their immune system. So protein is one of the important ones to help build the immune system. And eating adequate protein helps recover from illness and also helps fight infection. Cancer patients also have increased protein requirements just to help recover from treatment. So we see a general about 50, they could be up to 50% higher for cancer patients. So we really emphasize protein a lot. Now, if we look at Canada's food guide, so we see the 1/4 of the plate here that highlights the protein foods. I think on the next page, yeah. So protein sources. So some of the ways we get protein in our diet are from meat and alternatives. So it is possible to get protein if you do not eat meat as well. Chicken, for meat we have chicken, beef, fish, pork, eggs, but vegetarian options include lentils, tofu, nuts, soy, as well. Dairy also is quite a good source of protein. So dairy, milk and alternatives, including cheese, cottage cheese is a great source. Yogurt, Greek yogurt is quite a high source of protein. milk, and milk powder. So some other types of protein in the diet. Quinoa is a source of protein. We also see there's kind of some items in the market now, like they're higher protein granola bars and cereals, which are a bit more protein than some of the other options, and then ground flaxseed and wheat germ. So a few ideas for increasing protein in your kids' diet. Smoothies are a great way to get in extra protein. Like you can add in Greek yogurt, cottage cheese, nut butters, tofu, having nuts or trail mix available as snacks, adding milk powder to soups, oatmeal, casseroles, etc. Some of the nutrition supplements they're good sources of protein as well. So we do recommend those quite a bit. Depends. Some kids like them, some kids don't. Really depends. Some of the options are Pediatric or Carnation Breakfast Essentials is one that I do frequently recommend. I feel like it tastes a bit better and kids seem to like it better. And then cutting up cheese and having available for snacks is another protein option. All right, so the next macronutrient is fat. Fat is essential for growth and development, especially for the brain. We also need a good amount of fat to absorb fat-soluble vitamins. So fat is quite a concentrated source of energy. So increasing fat in the diet is a good way to get in more calories without having to add so much volume of food. So where do we get fat in our diet? So sources of fat are oils, butter, meat, dairy, avocado, and nuts. Do you see my avocado on every slide? It comes up a few times in my presentation. Omega-3 fats. So omega-3 fats are important for the brain and eye development. So especially important for infants and young children, and are heart healthy for all ages. Omega-3 food sources. We find omega-3s in fish, some nuts like walnuts, ground flaxseed, avocado, flaxseed oil, and then omega-3 eggs as well. So some tips for adding more fat into your child's diet, really adding butter or oil or cheese sauce onto cooked vegetables. Oh, hold on, I gotta get rid of this. Serving raw vegetables with a salad dressing, serving fruit with a yogurt or a sour cream dip, mixing cream with milk into cereal or oatmeal, nut butters on fruit, crackers, breads, oatmeals, whatever you can think of really, cookies, etc. And then smoothies, again, are a good way to add in more fat. You can add coconut milk, you can add cream, you can add coconut oil, avocado. All right, so carbohydrates. So these are our quickest source of energy. So carbohydrates really fuel the body quickly. They help us grow and heal. They digest faster than fat and protein, and are a source of fiber and B vitamins. So we get carbohydrates in our diet from kind of more the grain products. So the breads, pastas, rice, cereals, as well as fruit and vegetables, and then more like those sweet kind of snack foods, cookies, cakes, crackers, etc. And dairy products also do contain some carbohydrates. So some carbohydrates contain a higher amount of added sugars like cereals, cookies, and candy. So in general, we recommend choosing whole grains and fruits and vegetables more often, mostly because they also contain they have more nutrients in them. So if we see that kids are eating a lot of kind of the more processed carbohydrate foods, they might be displacing their diet with, not having enough room. They might not be hungry enough to eat some of the more nutrient-rich carbohydrates. All right, so carbohydrates basically fill up the other 3/4 of Canada's food guide. So carbohydrates are in a lot of foods. So those ones there. A little bit. So this prebiotic, so this kind of relates to the fiber that you get in the carbohydrates. So together, prebiotics and probiotics promote the growth of the healthy gut flora. So you've probably heard a lot about the microbiome recently. So prebiotics, they are non-digestible foods that support the growth of good bacteria. So they're a type of fiber in our diet. And probiotics are active microorganisms that when we eat can alter the gastrointestinal flora for health benefits. So you'll often heard these referred to as the good bacteria. So prebiotics, so food sources of prebiotics. So here, some of them are here: onions, bananas, garlic, asparagus, whole wheat, legumes, peas, and soybeans. So this goes back to trying to include more of the whole grains and more fruits and vegetables in our diet. So, and then here's some food sources of probiotics. Probiotic food sources include fermented vegetables, sauerkraut, miso, kefir, yogurt, pickles, and kimchi. Now, there's also probiotic supplements that you can get. Now, it's just good to know that they're not all the same. They have different indications, but if you ever were interested in starting a probiotic, it's good to speak with either a dietitian or a doctor about that. All right, so next I want to talk a little bit about bone health. So if your child receives steroids during their treatment, steroids can both reduce the body's ability to absorb calcium and can increase how fast the bone is broken down. So it's kind of working negatively in two ways. So it's essential to get adequate vitamin D and calcium in the diet to both help build strong bones. So for kids that are still developing their bones, so for most kids, and also to prevent the bone density loss. So the two things, calcium and vitamin D. So calcium, we encourage generally to get calcium through food if possible. Just eliminates the need for taking another supplement, and calcium-rich foods also provide a lot of other nutrients. So some good sources of calcium are milk, yogurt, cheese, and for people who don't eat dairy, there's fortified dairy alternatives. Now, if you are looking for a dairy alternative like almond milk, soy milk, rice milk, etc., just ensure that it is fortified with calcium and vitamin D. Most are, but not all, so just check that. And in general, we don't recommend the dairy alternative milks for kids under 2 just because they're so low in fat. So some other sources are soy, tofu, broccoli, and kale. The recommendation is to aim for 3 servings of calcium-rich foods per day. And if your child is unable to get through diet, a supplement may be recommended. Now, vitamin D, though the other piece of this, vitamin D is needed to absorb calcium. It's quite difficult to get adequate vitamin D in our diets. Food sources are sardines, salmon, tuna, and fortified orange juice. We also can get some vitamin D through the sun. However, in Calgary, we don't get a whole lot of sun through a lot of the year. So it's quite hard to get much vitamin D that way. So we do recommend a calcium supplement for most people. So just a quick note on milk. So milk is a great source of protein, fat, calcium, and vitamin D. However, too much milk can also displace other nutrients from the diet. So sometimes if we see kids drinking, a liter or more of milk a day, they often don't have room to eat other foods since they fill up on milk. So our recommendations is for younger kids, maximum 2 cups per day, and 3 cups for older kids or teenagers, depending on, what else is in their diet. So just a few things about if your child's appetite is poor. So some tips are, trying smaller, more frequent meals and snacks. Large portions can be very overwhelming to a child who does not have a very good appetite. Maybe if they have a bit of nausea, smaller portions can sometimes go a bit better. At meal times, recommend limiting screens and other distractions just to focus on the meal time. And then trying to incorporate higher calorie foods into meals. So like a little bit I had discussed about some of the higher protein and higher fat tips. And then so nutrition drinks like Pediatric, Ensure, Carnation Breakfast Essentials can help to supplement if your child's diet is not quite meeting their energy requirements. Okay, so now a little bit about the cancer nutrition claims, myths, all the things you'll probably see on the internet. So the first one is about sugar feeding cancer. Now, sugar is found naturally in many foods, like those carbohydrate foods. So fruits, vegetables, grain products, and then more the simple sugars like candy, etc. Now, all of our cells in our body, including our brain, need sugar. And even if we don't eat sugar, our bodies will convert fat and protein into sugar, which if we're converting protein into sugar, we can lead to muscle breakdown. So we want to avoid this. And we cannot control which cells will take up sugar. Okay, yeah, so our recommendations on sugar are to incorporate complex carbohydrates like fruits, vegetables, whole grains, and legumes in diet more often, and to offer the highly processed refined carbohydrates less often because they contain less nutrients. Foods like chips, candy, etc., can be included in part of a healthy diet. And just a note on low carbohydrate diets or ketogenic diets, we don't recommend them for children. They'll be missing a lot of important nutrients that kids need. And there's no good evidence to support following them. All right, so the next bit about on supplements or superfoods. So you might hear that supplements that can, this supplement can either prevent cancer or this one can treat cancer. So in this, I'm talking about high dose vitamins, specialized shakes, herbal supplements, or high dose antioxidants. So I just did a quick search on the internet and here's a few things that kind of came up for this. So you might see things like lemon can cure cancer, or kombucha, or natural cancer cures your doctor won't tell you about, or vitamin C therapy. So it's understandable that there's going on the internet and seeing all these things can be quite overwhelming, and there's a lot of misinformation out there. There is no evidence to support taking mega doses of any vitamins or minerals to help prevent or cure cancer. Most of these supplements are not regulated, and they may actually interact with your child's cancer treatment. So if there is something you are interested in, it's good to run by your medical team. And be wary of any of people selling supplements that they are making a profit off of. So our recommendations around supplements is to consume nutrients from foods when possible. Antioxidants are great when they come through food. They are in fruits and vegetables, chocolate, but there's no need for additional antioxidant supplements and can actually interact with your treatment. Multivitamin may be recommended if your child's diet is lacking in some, if there's food groups they're not eating, or if they have quite a limited diet, we may recommend a multivitamin for them. And we just recommend taking on days not receiving chemo to prevent any potential interaction. And again, if you're wanting to take any additional supplements, just discuss with your medical team. All right, so the alkaline diet. So I don't know if people have heard too much about this, but the theory of this diet is that an acidic environment is toxic to the body and increases your cancer risk. So this diet mainly limits processed foods, meats, and dairies. It encourages a lot of plant-based foods, but the truth is your kidneys maintain your blood pH, not the foods that you eat. So there's no evidence to support this diet. I mean, there are some good components of this diet, like trying to eat more plant-based. I think that's great, and eating more fruits and vegetables. But overall, I don't need to scare you to cut out all meat and dairy from your diet. All right, so now just a little bit about organic foods. So there's no difference in macronutrient composition between conventionally grown foods and organic foods. There's also limited research to show that organic pesticides are safer than conventional farming. And organic foods may not be affordable to all. Ultimately, it's a personal preference. So if someone was interested in organic foods, there's no problem with that. But just if cost is an issue or availability, and there's, no need to choose organic over regular foods. All right, so let's talk a little bit about creating positive mealtime experiences. So, and just kind of ways you can try to reduce stress around meal times. Oops, hold on, these are backwards, so I'm going to do this one first. So no doubt that feeding your child during cancer treatment can be challenging. There's, a lot going on. Their appetite might not be great. They might have taste alterations. The timing, if they're in the hospital, your schedule, there's a lot that goes on, and it's understandable that there can be stressful times around eating. One thing is to try to involve your children in meal planning and preparation. If this is something that's, if they're interested in this, helping them, decide ahead of time, maybe like ask them things they might want to make for the week, or having them involved in preparing the meal. So even if it's young children, like having them help with like mix up a salad or something like that. Trying to keep meals pleasant and relaxed as much as possible. And positive language at meals. So this even can involve parents, like, not saying negative things about how, feeling like super full after eating, or like worried about, saying feeling fat, or any of those kind of languages. So trying to keep that away from kids hearing those things. And then meal times, if your child is really is not eating their food, having them sit at the table for extended time periods is probably not going to help, and they're just going to start to have more of a negative association with it. So allowing 20 to 30 minutes for meals, and if they haven't eaten within this time, let your child leave the table, and then try, maybe 2 hours later offer a snack or another meal again at that time. Allowing your child to serve their portions to themselves can also be helpful. They can kind of choose how much food they want, and then they can go back if they want more. And new foods take time for kids to accept. Sometimes they have to be offered, like more than 10 times before they'll even be interested in trying it. So having it out there, having them try it, and when they're ready, they may or may not accept it. All right, and so just remember that food is more than just nutrients. So we talked a lot about kind of nutrients and components of food, but eating is also a time to bring family together. There's a lot of celebrations that involve food. Food connects us all together and creates memories. Like I'm sure we all have memories of meal times with families as a kid and special celebrations. So always try to keep that in perspective as well. Right, so just Merry Christmas to everyone and Happy Holidays. And thank you. Thanks for listening.
Thank you, Brittany, for those insights. The one that really stuck out for me is kids on treatment needing 50% more protein.
Yep.
And a few more. We have some good questions that came out of that, Brittany. And after Susanna's section, we'll dive into all of those questions shortly. So next, I would like to introduce Susanna Law. Susanna is a registered dietitian. She graduated with distinction from the University of Alberta, and she completed her internship at the Calgary General Hospital. Susanna has worked at the Alberta Children's Hospital for over 35 years, with the last 23 of them in hematology, oncology, and blood and marrow transplant program. More recently, she's been working with the hematology, immunology, and long-term survivor clinics, and has published a paper on carnitine profiles during transplant. Might have to chat about that partway through, Susanna. Susanna is very passionate about the psychosocial and cultural aspects of food and nutrition, and the promotion of a positive relationship with food. She is going to address nutrition beyond treatment.
This is the one. There, can you see it clearly? Okay, thank you for that lovely introduction. Can you hear me? Okay. Hello? Am I on mute?
Yes.
Okay, perfect. Yes, thank you. Thank you. So, gosh, sorry, I'm having technical. Okay. So, thank you. So, as I was told in the introduction, so I work in the long-term survivors clinic, and I've worked there for over 10 years, but have been seeing all kinds of patients in the oncology program for 23 years. So, and it keeps me going. It's very interesting, and I have a great passion for working with kids, families, and food. So, Brittany talked about getting through treatment and the diet, and so there's a lot of, pressure almost to stay healthy through cancer. Then you're done treatment. So I'll talk a bit about staying healthy. I'd like to talk about, I'm sorry about this, it keeps coming up, barriers to healthy eating, nutrition for late effects of treatment, and some nutrition tips to get through the holidays. So the big thing is getting healthy and staying healthy. So we're all familiar with Canada's Food Guide. How do I, hold on a minute. Sorry, going back. Sorry about that. So with the new food guide, I'm bringing it up because I know there was a lot of changes with this one. So in terms of health promotion, you've noticed it doesn't have all the groups and this many servings in this. So it's a general overall theme of increasing fruits and vegetables. And while we see a half plate of fruits and vegetables, often it's not half a plate of fruits and vegetables, it's often more of the carbs, but getting a wide variety of complex carbohydrates, lean meats and plant proteins, and also dairy. And so I will talk a bit more about that later, but and fiber is a big part of it, and fats and oils. The other component to staying healthy is being physically active, and it comes together with nutrition. So the guidelines, and keep in mind that I work in long-term survivors, I'm dealing with children who are anywhere from the ages of 5 to 18 and onwards, because we tend to see adults that are survivors of childhood cancer. So in this presentation, I'll be trying to deal with both. So I'm really sorry that this keeps coming up. So being physically active, so for adults, it's 150 minutes of moderate or 75 minutes of vigorous per week. If you're a child, young teen, it's 30 to at least 60 minutes per day of staying active. And the benefits of activity are it helps control weight, it increases a sense of well-being, reduces fatigue. I know it's tiring when you want to exercise, but when you exercise, you feel so much better, improves sleep. And studies are showing that it does help reduce the risk of cancer through a number of different ways. And it also has many positive effects on stress management, anxiety, depression. And we all know that all those things can affect the diet. The third component is getting adequate sleep. And the thing about sleep, it's not just getting rest, but it improves hormone function. So it does a number on your hormones that may affect appetite and then affect rhythms in your body. It helps reduce fatigue. That can be related to weight gain, improves cognitive function, and weight management. So then now we are dealing with pediatric cancer survivors. So it's one thing to say get great exercise and diet when you're a child that's gone through relatively healthy, but you're dealing with children that have gone through a lot of treatment and a lot of trials and medical issues to get to the long-term survivor clinic. And as one of the questions earlier on, I will be talking about some of the barriers. So there's more research coming in with acute lymphoblastic leukemia survivors, or I'll refer to as ALL. So obesity has been associated in survivors of ALL. And Zhang looked at some of the issues that arise from that. And we all know that there's rapid weight gain during the induction phase, which is the first 28 days, and they're on high dose steroids. And we know that some children, there's increased weight during remainder of therapy. It also increases the risk of insulin resistance. And sometimes during therapy, we have kids that need to go on insulin, their blood sugars are high, and we have to watch it. There is a documented early onset of obesity and higher risk of chronic disease in survivors. And the other thing that they've found is that it's oftentimes much harder to change diet habits after regaining weight that has been lost through treatment. So in this particular paper, she did an analysis of pediatric acute ALL survivors. And what they found was that, which we all know, steroid therapy increases oral intake and weight gain. What is interesting is that the BMI is what's known as the body mass index. We're comparing weight per height, basically, and there's certain ranges it should be at. But the BMI peak at 30 days, interestingly enough, is not a predictor of body mass index at 5 years of age. So I know it's concerning to seeing a child, they may not have been eating, they may be thin, suddenly they gain so much weight on steroids, and it can be scary thinking, oh my goodness. Oftentimes the weight does come down after the steroids are tapered, sometimes below what they used to weigh. But what they're finding is that in many ALLs, children, the peak weight does not always return to the pre-treatment levels. So they found that the biggest diagnostic predictor of weight post-treatment was the BMI at diagnosis and also at weight at 1 year post. So there are many children, some are underweight when they're diagnosed and some are overweight. I find that ALL doesn't necessarily promote a lot of weight loss prior to diagnosis. Some of the solid tumors, they tend to lose weight before being diagnosed. But with ALL, it can go either way. So the one at diagnosis, if you're, tend to be a higher weight heading into treatment, you're maybe at higher risk later. And the risk factor is for metabolic syndrome, which I'll explain briefly later, and chronic disease and relapse. So here, when we talk about metabolic syndromes, we talk about increased weight or obesity, or it can be high cholesterol levels, high intakes, high cholesterol, increased risk of fatty liver. We see diabetes. And again, it's because of the chemotherapy that if children are receiving radiation, it does increase risks of high cholesterol and obesity because it can affect different hormone levels. So further barriers in addition to ALL treatment is the nutrition habits. So habits that developed post-treatment. So in some of the studies that looked at dietary guidelines, they found when they compared the children that had gone through chemotherapy to those that had not randomized to a healthy population, they found that children of cancer had lower intakes of vitamin D, calcium, which is interesting because we really need it for the bones and for the treatment of steroids, vitamin E, potassium, magnesium, and fiber, while they were having higher intakes of sodium, saturated fat, and quote unquote empty calories. Some of these habits, they found that the older survivors had better diet habits than the younger, which makes sense because you've got a period of time in those first 5 years when you're developing dietary habits. So the older you are, your habits are more established. But that also refers to the fact that older adults, so survivors that are in their 30s versus in their late teens, have better diet habits. And I certainly see that. So I've worked in patients before, and through the years, some of the kids I used to be involved with in inpatients are now adults. And, it's taken a while and we see definite progression in interest in improving their habits. So that's a very valid statement. So those at 5 years had lower diet quality. They found that high dose radiation to the abdomen reduced the diet quality. So, and that's because of the gut hormone secretions. And there's a lot of interaction between the gut and the brain, the different hormones that affect that lead to appetite, and definitely changes in cravings, taste preferences, and appetite overall. So they also found that the habits of survivors was that when they went through treatment, yes, there was a decreased intake of fruits and vegetables. And as we heard Brittany talk, we want to preserve weight. and muscle mass when you're going through therapy. And so fruits and vegetables, they're healthy, but oftentimes, there's more incentive to promote foods higher in calories. So your meats, your carbohydrates. And interestingly enough, this diet found, the habits found that carbohydrates were very high during treatment. After treatment, it was more increased portion sizes. I'm terribly sorry. I've got to totally sorry about that. Increased consumption of junk food was another thing. So the changes in habit that happen during treatment are that there's a lot of learned aversion. So when we're talking with chemotherapy and the side effects of nausea, vomiting, there are some foods that children associate with getting sick. So it's quite common for me seeing them 10 years after treatment to say, oh, I can't drink milk anymore because it used to make me throw up. Or I had this particular brand of hamburger right before I got chemo and they can never eat that particular brand again. So you see that and you see what makes you feel good. And some children go through what's known as food jegs. So they might go through chocolate milk through one cycle and then go through macaroni and cheese for another cycle and then not be able to eat it anymore because they're tired of it. So they learn what makes them sick before and they keep it on, or these foods remind them of their treatment. Again, as I mentioned earlier, the big goal during treatment is preventing weight loss and malnutrition. So especially some of the solid tumors where there's a lot of weight loss, you want to make sure that you're promoting muscle mass and an immune system. So you want to eat. Then the study found there's a lot of change in parenting styles regarding food. So your child's been diagnosed with cancer. They're going through a lot of pain. It's a lot of emotional stress. Their appetite is bad. So a lot of rules around the house or structure are relaxed in order to help promote food. It's like, if Charlie wants this, Charlie's going to get that. You want them to eat. And then the fourth thing is there's a push and pressure to eat. So some families may feel like they've been told, and sometimes the medical teams will say, eat. You got to make sure they eat. And then parents, relatives, well-meaning things, you're, chasing Charlie around the house, making them eat, pushing them to eat, pressuring they've got to eat or they're going to starve or this or that. So all of those things are not necessarily turned off after treatment. So the big thing of the study was that the diet beyond treatment, it continued to have the same, and we surely see a lot of that. So there's the big milkshakes or the smoothies that we need for calories, the pizza and the fries. I mean, that's not just cancer survivors, everybody, but what we find is that kids tend to eat a lot of those foods going through treatment. There's a lot of flavor, they can taste it, and they're higher in calories. And then the bottom picture is very true, because oftentimes you're trying to distract them from eating, from medical procedures, whatever. And so that is one of the few ways to get your child to eat, is having that laptop, the phone, the computer in front of them. And that's for all ages. Now, again, when we talked about ALL therapy before as well, right? I mean, all types of cancers have their own specific types of side effects, but they can be mixed. So there's a lot of physical barriers as well that we see. Now, some are side effects. So some people affects their eyesight or hearing loss due to the side effects of some of the treatments. Bone, it can be osteoporosis, or for those that have osteosarcoma of the bone, they may not be able to walk as well or be as active. Mobility is affected in some people. Some of the chemos affect the heart, the GI tract, and then with the nerves, if there's neuropathy, some people can't be as active with a particular hand or may not be able to walk as well, and some may be temporary. I'm just going to see if I can't see it. Okay. And some can be temporary, some could be full. And then there's the cognitive. So many times, some of the chemotherapies, it could be the brain tumors, and it could be other effects, side effects of chemo, but memory can be impacted, processing speed, the ability to concentrate, focus, attention spans, and all of those things affect how we take in information about what's healthy, what's not, what guidelines to follow, remembering guidelines, remembering medical therapies, all that. And then a big one is psychological. And again, it affects all kinds of children and teens, but specifically with late effects, there's a lot of anxiety and stress and depression resulting from the therapy. And I put PTSD down because it can be post-traumatic stress syndrome, not only in the children, but in the families as well that have had to deal with that. And, if the children are young, the parents are still responsible for the diet. And sometimes kids are feeling guilty for surviving, or they don't want to go near the pain, or they're scared of the cancer coming back. All of those things affect it. And then there are children with ADHD and OCD, and some may have been present beforehand, and some may have developed, not necessarily from the treatment, but whether it's genetic or situational, whatever, but we do see a wide variety of it. And I have to say, and tech. Tech is a huge barrier for optimal eating habits. And these pictures, the teens, again, I'm seeing younger kids with it, and the types of foods that are often eating while on your laptop, almost like the movie theater where you're not really paying attention to what's going on. And I added a new slide just before the presentation because one more barrier that I have seen in the last year to year and a half is COVID. And almost every single cancer survivor that I have seen that has had weight issues, it's all that they have increased during COVID. So people are told to stay home. A lot of the activities have been closed. I mean, especially last year before all the vaccinations, schools were closed down. And what did people do? They were at home, and it leads to increased snacking and decreased activity. People were depressed, people were shy, and a lot of emotional eating, overeating, and higher portion sizes. Going out, I mean, people ordered food in, but there wasn't a lot of structure at all. So it's starting to get better. Other barriers is once you've gone through treatment, then you go back to school, then you're dealing with social status, friendships, Facebook, email, more computer stuff, but just making the transitions. And some kids are scared to eat lunch at school because their eating habits, maybe they're not hungry, maybe they don't want to eat in front of people. There's all sorts of barriers there. The transition between junior high and high school, studying for finals, trying to get into post-secondary, then we get into university and college, it's a whole new lifestyle. So you may be gone all day, you've got classes, you don't have time to eat, or you're dealing with campus food, or if you're living in residence. So there's weight issues there. Then people are dealing with boyfriends or partners, friends, they're getting married. That changes feeding habits as well. Starting a career. Again, sometimes it's easier than the post-secondary because you're not studying day and night. You get more of a structure. So sometimes things start to improve when people start working, and then you're moving out on your own. Now the moving out can happen after high school or post-secondary. Then you're dealing with people that don't know how to cook. They've depended on their mom a lot. They may not have gone grocery shopping. They don't know how to buy food, prepare different things, store it. So with all those barriers, how do we move beyond? So I'm hoping that just to provide friendly tips on how to cope with moving behind the late effects things. So how do you eat? Now, this is a standard thing, maintain a healthy weight. While we're getting away, we don't want to just focus on weight. You have to keep in mind that for this population, even a small weight loss of 5 to 10%, if there's risk factors present, can help reduce further risks. So with heart disease, fatty liver for sure, risk of diabetes. So it's a mild weight, because I do see some people that come to me and they want to lose a lot, like it's way beyond, but a small amount of 5 to 10% is quite healthy. Be physically active. And I put that to make activities fun and enjoyable, because like being on a diet, having to exercise becomes a burden. And what I find is people are gung-ho, yes, I'm going to do this, this, this. And then when you see them, they've either tired out or it's really difficult. If it's like, oh, I have to go downstairs and go on the treadmill for 30 minutes a day, every day, that does not promote compliance to that. So make it fun, do something with a family member, a sibling, walk a pet, join things now that things are open, but it's got to be enjoyable, because this isn't just a prescription diet for 1 month. This is lifelong habits. The other thing is the balanced plate. So like the food guide, we recommend half fruit, vegetables, so good salads or whatever, quarter meat and quarter starch. So again, easier said than done. Even if we kind of pay attention to the fact that some people are eating a full plate of carbohydrate and then everything piled on top. So just small changes. Adequate vitamin D and calcium. We should all be taking vitamin D in our with our climate and our northern climate is what I'm trying to say. What I find that people are good about taking their vitamin D and calcium when they're going through treatment, especially ALL, and then as soon as they're done treatment, it's like, I don't need it anymore. But you know what? In addition to increased weight, the vitamin D requirements are higher, so it should almost continue regularly throughout your life to make sure you get your vitamin D and calcium. Avoid fad diets. I see all sorts of different things. Whether they're fad diets or not, be careful with what you eat, because sometimes there are nutrients missing and there are different needs that we have. Get adequate sleep, which I discussed before. Limit alcohol for those who are teenagers and above that are drinking. So the limit is generally 1 drink a day for females, 2 for males. Yes, some kinds of wine sometimes in moderation might help reduce some risks of cancers, but overall, alcohol can increase the risk. And drink water. A lot of water flushes through medications, keeps you hydrated, keeps you feeling better. So generally the type of diet is eating more of whole grains, lean proteins. We all know these things: fish, poultry, lean meats, plant-based proteins, your lentils, your pulses, nuts and seeds, fiber. I'm going to say fiber a lot of times through this presentation. Low-fat dairy products. And when I say low-fat dairy products, I think there was a question about that earlier. I'm just going to address it quickly here. Is generally for kids under 5, we do promote homogenized milk. They need the fat for their developing brain and nervous system. If there's an issue with weight management, then 1% milk would be adequate. 1 to 2% sometimes. The saturated fat that is in dairy products is not necessarily as harmful as some of the other saturated fats that you get. So it depends on weight management. So 1% is fine. Skim milk, people still need some fat in their diet. So it depends on what you're dealing with. Unsaturated fats like olive oil, avocado, and again, low-fat dairy products. Eat less of refined grains and starches, the saturated fats that you often get from meats and stuff, added sodium, high sugar, fructose foods, and fluids. So Brittany discussed the high sugar and sweets, but fructose can be very damaging to the liver. And so that's often found in corn syrup solids. And you have to be careful even with what's seen as natural sugar food. So, some of the big smoothies you get, I'm not picking on Booster Juice, I'm using as an example. If you ever look at the content of the fructose in a large serving, if it's got a lot of fruits, plus they're adding sweeteners, it can be quite high. So if you have fatty liver, you have to watch your intake of fructose. And then processed foods. In a nutshell, all those things that I've discussed fit in with a Mediterranean diet for those that are at risk of high cholesterol, high lipids, and those at risk are some of the neuroblastomas, Hodgkin's, and people that are having weight management issues end up having higher lipids, higher cholesterol. So I do like to recommend 2 servings of fish a week if you can, or fish oil supplements. And eating the whole food is always better than the supplement because of all the other nutrients that help its absorption. Nuts, seeds, fruits, vegetables, all of that helps, just similar to the food guide. And did I say I really think fiber is important? I'm going to say it again. With fiber, what it does is it forms a gel, and for people dealing with high cholesterol or fatty liver, it helps flush both fat and cholesterol out of the body. So with fatty liver, high fiber diet. With cholesterol problems, get that fiber in. And fiber's not boring like we used to think it's just wheat bran. It's a number of fruits, vegetables, nuts, and seeds that can be added anywhere. And Brittany talked about prebiotics, and so those help promote healthy gut bacteria that have been associated with weight management, improvement of moods, and all sorts of things. So we advocate a slow increase in fiber. You don't want to go from 0 to 3 cups of lentil soup because you'll have pain in your stomach. And you need to drink adequate fluids when you're having higher fiber. Other tips to overcome barriers are Michelle May. She has a company called Am I Hungry? And she advises on good relationships with food. Because if you notice, I don't like to say diet too much, bad foods, good foods. It's more eating a variety of foods. But the big thing to eating is eat when you're hungry and stop when you're not. A big barrier is that people just like to eat and they eat for the sake of eating. And then that leads to overeating. Please remove distractions, reserve time for meals. So distractions can be the TV, the laptop, going in your room, talking on the phone. If you reserve a special time for meals, then people will start to enjoy the food, because what society's kind of going to is you're eating to live versus living to eat. So, when you used to have time where it was dinner time, it was lunchtime, and you're actually reserved for food. So you know what's going in your body. Ask yourself why you're eating when you're hungry. Is it because you're bored? Is it because you're stressed? Is it because you're nervous? So ask yourself. Be mindful of what you're eating. So enjoy each bite of food, the taste, the smell, the sight. It's hard to do when you're having distracted eating. And the big thing is don't skip meals. Sometimes there's some children and young adults that their appetite's just not that good in the morning, and they may get nauseous when they're eating. But then I advocate to have like a morning snack that's got protein. If people are skipping meals in the morning, what often happens is they end up doubling up later on because their hunger is that much higher. Other barriers to overcome, as I mentioned before, eat together. The family meal is very difficult sometimes with different schedules, work schedules, and preferences. But when you can eat together, I have seen several cases where the family's eating in one room and the children are eating alone in the bedroom. Bring them out, have conversation, eat at the table. Studies have shown that kids that eat at the table develop better eating habits. They have, decreased risk of depression, anxiety, because there's support at the table as well. And then you can, I don't advocate discussing foods or pressuring people to eat at the table, but just a nice family meal. Please turn the tech off. Enjoy what you're eating. Another big thing is take your child grocery shopping. Again, I've worked with teens, they're ready to move out, or people that have moved out and they don't know how to shop or what to buy. The other thing is if you take your child grocery shopping, it will help increase exposure to different types of fruits, vegetables, and other products that they may not be as familiar with. Have them choose a different fruit, have them choose something. And above that, take it to the next step and help them plan, prepare, and even cook basic things like they're doing here. Oftentimes, if you're involved in the preparation of a particular food, there's a higher chance that you'll eat it or feel proud of it or feel less anxious towards it. Exposure is the key thing. And I love this slide because it's not just girls, it's boys in this slide. And look at the types of foods they're having. So probably they don't eat a lot of these foods at this time, but you're preparing the broccoli and you're putting little cranberries, whether it's on a punch or in a stuffing or whatever, but you're getting familiar with it and you're involving them. And it's really good bonding time too. Rather than having them be on their laptop, they're helping you in the kitchen. So further holiday tips for eating. So I've kind of come up with Michelle May, the information from her, but this is what I kind of see. So here's our version of a holiday and special event diet. This time of year, all you see is how to reduce calories, how to get through the holidays without gaining weight, how to avoid. So the big thing, Michelle May, is eat what you love and avoid what you do not. There's no point in having to eat the celery sticks if you hate them, but you're, avoiding and scared of eating, a small little sweet or piece of cake or whatever. You don't want to promote guilt. Don't fill up on foods you do not enjoy because they are labeled healthy. And the look says it all. I mean, she's going to be feeling guilty. I will talk about this in the next slide. I was going to say, what do you think she's going to do here? What do you think you would do given those choices? Okay, this is all tied into something that it's called food labeling, and you hear it all the time, and you hear it from health professionals. In addition to families, you hear it all the time, is labeling. So I often hear people say, oh, it's junk, it's bad, it's garbage, it's this. But I want you to keep in mind that levels change a lot. So you know that I've worked a few decades at this thing, and When I was going to school, I was taught that all fat was bad. So having grown up with the Mediterranean diet, it was really disconcerting to hear that olive oil couldn't be put in a salad because it was bad. It was a fat, despite the fact that there's been centuries, for thousands of years, people in the Middle Eastern countries all over have lived with olive oil and fats. So that was previously bad. Now it's all the rage. At that time, it was pastas, muffins, breads, all healthy. And what did people do? They started eating so many carbohydrates. You don't have a lot of fat. You're decreasing your meat consumption because it's got fat. And so we've got a population of heart disease, diabetes, obesity. So we're kind of changing things around a bit more. Unhealthy, bad for some, good for others. And for this one, sometimes if you are labeling food that, let's say, is not organic and non-GMO free and fresh as healthy only and everything else is bad, what about the families that cannot afford to buy organic fresh food every day? Some people think frozen food is bad. Actually, frozen food is great because the fruit is picked right at the point of being ripe and the nutrients don't kind of decrease as it goes through transport. But again, some families, you buy food and you store it in your freezer. It's not necessarily bad. There are people that have food allergies and cannot eat some of the foods that may be considered healthy, or those on special diets. So in school, sometimes you have to be careful because teachers might think, I had one child's mom tell me that they were told that the banana bread that had some margarine on top, they were very thin and needed the extra calories as a snack, was taken away because the banana bread was deemed unhealthy. So you need to be very careful because it's diet specific. Then there's also rich foods, which are central to celebrations, traditions, and cultural practices. If you are labeling something bad, then when they get to these things or a wedding or this or that, then you're going to set up feelings of bad or guilt. Labeling elevates the values of restricted and bad foods. So if you're labeling dessert bad, when you're eating it, it's a forbidden fruit. Pardon the pun. So they don't want that. They're going to want that for dessert. Again, eating can increase the risk of guilt, overeating, and the feelings of failure. And I hear that a lot. Yeah, I started eating the chips. I felt so guilty. I couldn't stop. And I had eaten them already. I might as well finish it. So there's all of those issues. The big thing is that labeling is often subjective. As we've seen, everybody has their own version of what's healthy, what's not. It's very private. So getting back to this girl. So if it is somebody that has been watching their weights, they're going to look at that bowl of salad and go, I'm too hungry. I don't want to eat that. And not only will they eat one donut, they will clean off both donuts and in probably less than 5 minutes, guaranteed. And they'll still feel hungry and go get the chips. If it's, and that's because those donuts have been labeled bad. The other, good. If it's somebody that doesn't have that negative relationship with food, what they're more prone to do is, okay, I'm going to have some salad. They'll eat the salad and I'll have a donut. I don't need to because I may be full from the salad, or I don't need to eat a second donut because there's no emotion attached to it. And interestingly enough, this labeling of food got started with the weight loss culture because most foods that are labeled bad are weights that promote calories and weight gain. And so not everybody is in that position. The third rule for this diet that I've come up with is restrict self-punishment. Do not starve yourself all day before your event. So you hear that, oh, I've got a wedding tonight. Oh, I'm going to this Christmas dinner or Easter or whatever celebration you're celebrating. So you starve yourself all day. And then when you get there, you're like, well, I didn't eat all day. I can have double portions. In reality, you are that much more hungry at the end of the day. You are going to be probably more than double. The other part of reality is that a lot of foods that are prepared commercially or at special events have double to triple calories of the homemade food. So you will be getting way more calories than you would think if you starve yourself and are more hungry. The second thing is don't force yourself to over-exercise to burn off extra calories. So it's quite common to hear people say, okay, well, I ate 300 calories and I'm going to go run for 3 hours to burn it off. That also sets up a negative relationship with food because it's like, oh, I don't want to eat that because then I'm going to have to do this. It's a real vicious cycle once you're in that mode. And the third thing is don't feel bad about eating, as I talked before, and then self-comfort yourself by eating more. So the one rule I do like to promote is enjoy yourself. Eat an item if you are hungry and if you like it and if you want to. So if that brownie is calling your name, eat the brownie and try not to feel guilty. Stop eating when you are full. Do you need the second piece? I often like to say it takes a good 20 minutes for your stomach to tell your brain that you are full. So if you go to McDonald's and eat a Big Mac and a supersized fries and eat it in less than 5 minutes, you will be hungry. And that is a very common thing that I see with people that are trying to control their weights. They eat on their computer, they eat in less than 5 minutes. Some might be standing. They don't even know what they're eating, how it tastes. And then they just keep eating. So they're not realizing they're full. So drink and eat slowly, ideally 15 to 20 minutes. If you want seconds, just hold off. Give it a 10 to 15 minute break. See if you're still hungry. Guaranteed, you may not eat as much on your second portion. Drink lots of water. And if you're in an event where it's just punch and lots of sweet things, try to drink water, maybe alternate, maybe dilute the fluids, because it's really easy to get all your calories from 5 to 7 servings of punch or pop or a juice. And nowadays there's lots more flavored waters with lemon or fresh fruit that you can try. Enjoy the food, flavor, texture, smell. The big thing is enjoy the company, enjoy the kind of food, enjoy the occasions. I know it's easier said than done. I'm trying to get away from letting food have power over you, because when that happens, you're more drawn to it. So have fun. I wanted to put this slide there because fruits and vegetables can be cute. You can get your kids, young adults, to make that. If you're making a broccoli tree with little ornaments, chances are they might kind of sneak in a tomato or a little ornament or a little piece of pepper. Help them decorate it. And it does not just be vegetables. It can be fruit with slices of cheese and meats, or the tree with different plates at the bottom. But get your children involved and start it at a sooner age. And, you know, if you are have had ALL and there's weight issues, start to do all this sooner rather than later to instill those habits as we get older. So enjoy the foods of the season, and thank you for coming.
Thank you, Susanna. I love the cheese and fruit trees. Love it. Thank you for the important information. Some super interesting research as well. Let's go through the questions. Let's see. I'll read the questions, and if the person who put forward the question doesn't feel it's answered in the way that they'd like, please step up and let us know. Long-term effects of treatment regarding weight gain. And is it normal for weight gain after treatment? You did cover quite a bit of that, Susanna, in your piece. Is there anything else you wanted to add to that, Susanna or Brittany?
I was just going to ask if whoever posted the question, if they had more specific questions, because I did address a lot of that. Was it answered during the talk?
Okay, we'll see if they post something else.
No, I think the lady might have been, she's not there anymore.
Lay,
yeah, she's not there anymore.
Okay.
So I may have answered it.
Okay, yeah, she was maybe waiting for that one piece. A good question about milk. Is whole milk better or 2% milk instead?
I addressed parts of it, Brittany, if you wanted to.
Yeah, I think, yeah, you did address it. Yeah, I think there's, I don't know if you can necessarily say one is better than the other factors involved, but if you definitely if you have a young child and weight gain, maybe they're not growing as much as we would like, then switching to whole milk is a great option. And definitely if it's a preference for younger children, I think there's nothing wrong with whole milk. Yeah.
Thank you. Sugar. Does sugar feed cancer? Is there a black or white answer on this?
So I guess back to it's all of the body cells, and cancer will all feed off of sugar. So technically yes, but there's also no way to control not getting cancer or stopping the sugar from getting to the cancer cells.
Yeah, and that was a valid question and answer. As somebody said, the black and white thing. So it's not necessarily a black and white. Like definitely on the pyramid of foods, sugar has the least role for cancer. So whoever asked the question about diagnosing through the, where did it go there?
Oh, the radioactive.
Yeah, the radioactive.
Like a PET scan.
Yes. So sugar cells are very actively metabolized by tumor cells. That's a fact. I have personally worked with people that, have reduced sugar, the keto diets, but like Brittany's saying, they don't necessarily work. It is and part of that reason is there's so many other factors, but compliance to those diets is very, very difficult. You're dealing with children that barely want to eat. And it is, you're dealing then with birthday parties, celebrations, this and that. It's tough to get them to stay to a very low diet. There's a lot of weight loss. And there's other factors that need to go. So it's not just necessarily reducing sugar. Certainly we promote, you don't need a lot of fruit juices, even from the obesity part of view, the ALL, the diabetes, all that. Keep sugar to a minimum if you can. And that's why I like dilute the juices if you can, promote water. You don't want to overdo sugar. So it's not feasible to take it 100% out because your brain still needs to function. And if it doesn't, you go into like a diabetic state, and that's not good either. So it's a long answer. So I would advocate reducing sugar, but don't be worried that it's feeding the cancer cells, because if you're malnourished, your body will break down your muscle, will break down stored things to get that glucose to keep it going.
Did you want to add anything to the question, do they use radioactive glucose to find tumors?
I've heard of that before.
I think that's, I'm guessing like a PET scan. Is that kind of what they're referring to?
Yes.
Yeah, so that is correct. And yeah, Susanna kind of addressed that about how they do use them because they do take up sugar quite rapidly.
Yeah.
And the sugar question is popular. Does brown sugar, raw sugar, is it better than refined white sugar?
Brown sugar and white sugar are very similar nutritionally. I think brown sugar might just have a little bit more minerals in it, but other than that, there's very little difference. So I would say go with what's your preference.
And I have seen bags labeled raw sugar. Is that different than brown sugar?
Means it hasn't been processed. I think with sugar, the big things, and I'm just going to come at it with my long-term survivor's hat with fatty liver and obesity, is sugar is broken down and there's fructose in sugar. So that's a high risk for fatty liver. For anybody, we shouldn't be getting a ton of fructose. So the components are still the same. Does that mean his body's asking for more sugar because the cancer is metabolizing it so fast? So when kids ask for sugar, there's a lot of yes and no to that. I don't know your child that well. There are several different things. I don't know if there's a history of restricting sugar. If you restrict sugar, people will crave it more. So when I first started as a dietitian, I worked with ADHD kids quite a lot. And we would have kids that would go find the cupboard with the sugar. Their parents would lock it and they were craving it. So sometimes I guess you're feeding something. So for ADHD, you have a high attention span, you need that buzz. And so some kids are self-medicating with sugar. Carbohydrates are self-medicating for emotional stress and that type of thing, because it kind of gives you a bit of a buzz. So, but that's an interesting question. I have not heard of people craving sugar for cancer because of the tumor. Yes, tumors use glucose. Does the body crave it? I don't know. The thing to be careful, because I've done a lot of research with that, is just because you reduce the sugar, some tumors, depending on the type of tumor, will find ways to compensate and try to use other nutrients to bypass it. So those diets are not necessarily black and white, to use that term. There's a lot of research that needs to be done, but it's not just starve the sugar, starve the tumor, starve the that I have seen kids that have gone away to other places to get different types of therapy and come back malnourished and succumb to their disease from malnutrition. So we need to be careful. And I have seen tumors grow while on low sugar diets as well.
I'm going to keep going in order. Sugar may come back again. This one is, and perhaps related, body metabolism. Is body metabolism lower or higher when you're going through cancer treatment?
So a few factors involved in that. So your resting body metabolism, it could be increased because of the cancer treatment itself or the tumor presence, like how we talked about how it's very active, like it's taking up glucose really fast. So having a tumor present could cause your metabolism to be higher, as well as if a child has a fever, you're in a hypermetabolic state when you have a fever. Also, like recovering from surgery, those could have increased requirements. Now, the one thing is that if your child had been very active before treatment and is now much less active, that their overall energy requirements might not be higher, and they might actually be less, just because their activity has gone down quite a bit. So I hope that answers that.
Thank you.
I think in the
question.
past, they used to overfeed everything. You have a fever, increased metabolism. You have this, increased metabolism. So we're learning that it's not necessarily as high as you think. Sorry, what was the question again about energy during cancer? And I'm sorry I had to run, but
Body
sometimes
lower or higher.
Unfortunately, if a tumor is progressing a lot and they're quite ill, then their requirements go very high and the body becomes hypermetabolic. And in those cases, the calories don't solve the issue. So that is only in severe cases that see a severe increase in the metabolism.
There's a further question about this that is related. What is metabolic syndrome?
You want to answer, Susanna?
Sorry?
Oh, the metabolic syndrome.
Oh, the metabolic syndrome?
Yeah.
Hello. So for metabolic syndrome, it's the syndrome consists of oftentimes obesity, high lipids, fatty liver, high blood pressure. Oftentimes they're seen together under that umbrella of metabolic syndrome because it affects metabolism. So, and diet, what I forgot to say too was you can't control the late effects of a lot of the toxicities from chemotherapy, but you can help control the diet, that using the diet to help with those late effects. So the metabolic syndrome, late effects, diet, exercise, sleep, those are the ways, and well-being, right? Because a lot of times we are dealing with stress and anxieties. And so, we do have a therapist through the long-term survivor clinic because we need to address all of them. If you're still suffering from a lot of anxiety, it's going to be harder to decrease stress eating until you come up with, the reasons for a lot of those other factors.
Thank you. Here's a comment. Thanks. Someone said, I already feel less guilty now for eating through the Christmas season.
Perfect.
An interesting comment about sugar again. I noticed that the sugar cravings for my child increased just before he was diagnosed. Does that mean his body is asking for more sugar?
Well, I hope everybody enjoys their food at Christmas and every other occasion.
Yeah, and I think Susanna did address that question.
Yeah.
Which one?
Yeah. Anything okay? If they have further questions about the metabolizing.
Am I on mute?
Please carry on. There was a thank you for the extension of your knowledge and time. I need to step away. Very informative. That was from our coworker, Pam.
And then, I guess the body metabolism, that was through cancer, but when you come out of treatment, your metabolism is going to vary. Again, if you have a lot of the side effects of treatment, such as mobility issues, it's well known that depending on the medications that affect your heart, you may not be able to do exert yourself as much for exercise. It has to be low intensity exercises, so that can affect caloric expenditure. So there's all sorts of factors that go into it. But overall with ALL, I would say that your metabolism, you're going to have to just assume lower, so that because you're at higher risk of metabolic syndrome through that. And like I said, it's not just the ALLs. I mean, the any type of therapy that has resulted in radiation to the head, to the abdomen, and even for those that have undergone bone marrow transplant and have had TBI, that can also affect increased risk of dyslipidemia and obesity later on as well.
Thank you. Any more questions from the audience?
Is there any fun questions?
Fun? How'd you make that broccoli tree? All right. Well, thank you. Thank you so much, Brittany and Susanna, for so generously lending not only your time this afternoon and preparation for your talks, but also all your
those of you who are in clinic, you know where to find us, right? We're always in clinic. I'm in long-term immunology, and then Brittany's in inpatients, and then we have Lindsay Gervais in outpatient clinics, but we're always available.
Thank you.
Thank you
for allowing us to record your sessions so they can live long on our website and touch more people. There was a mention in, I think it was in Susanna's, about the importance of physical activity. If we have any new families on board that haven't heard about our PEER program, our Pediatric Exercise Recovery Program, please look for that information on our website to add to that. Thank you to all of our participants today for your time and attention, for joining us today. We hope to send out an email with a survey, of course. We truly value your feedback. It helps us to keep improving our work and to best serve your needs. So thank you, participants, and enjoy the Christmas time and enjoy the food, guilt-free.
Yeah. Thank you so much for taking the time to listen, and hopefully everyone took something away from this that's helpful to you. And our email's in the presentation. If you have any more follow-up questions, feel